To this day, Oregon, Washington, and Montana are the only 3 states where the Death with Dignity Act is legal. The Death with Dignity Act states that terminally ill adults may get prescriptions from their physicians for lethal drugs and self-administer them. The controversy regarding this act comes from the American Medical Association that states the intentional termination of the life of one human being by another, mercy killing, is contrary to that for which the medical profession stands and is contrary to the policy of the American Medical Association. Many people believe that the act is morally unacceptable because it is a physician's job to be benevolent and do whatever possible to treat a patient. But what happens when nothing more can be done? Due to modern medicine, there are machines that can maintain a person's breathing and heartbeat indefinitely, even though there's permanent brain loss and there's no brain function. Heart and lungs keep going, but the individual is irreversibly brain dead and can remain that way for decades. This is where the question of morality comes into play. Is it moral to put the patient out of their misery or let the patient's body remain alive while their soul is non-existent and for the benefit of others? One of the main arguments against physician-assisted suicide and the Death with Dignity Act is the slippery slope argument that mentions allowing active euthanasia or physician-assisted suicide will inevitably lead to heinous extensions of the perversions of original practices. One of the main concerns is that if legalized, physician-assisted suicide will quickly transcend into active non-voluntary euthanasia, and that the physicians and or family members will push unsure patients towards assisted suicide. It is also believed that nurses and physicians will be more open to administering lethal injections to elderly, mentally ill, chronically ill, uninsured, and disabled patients. Another argument made by Rita Marker, Executive Director of the International Task Force on Euthanasia and Assisted Suicide, is that physicians could still practice assisted suicide, but they could not prescribe federally controlled substances for that purpose. What Marker is referring to is that physicians could still prescribe lethal substances as long as they are not federally controlled substances. For example, rat poison would be unacceptable to administer. But thankfully, due to medical ethics and the fear of lawsuits, this isn't an option. I want to argue that the Death with Dignity Act is morally acceptable if and when proper regulations are put in place. The Death with Dignity Act states that the patient must be diagnosed with a terminal illness that will lead to death within 6 months, an illness where no further action and treatment can be given. The Act emphasizes autonomy, stating that the patient must be capable of making and communicating healthcare decisions on their own. If the physician and psychologist and or psychiatrist have any doubts of the patient's mental state, further psychological examinations must be done before a decision to end the patient's life takes place. The Act also emphasizes informed consent, stating that the physician must inform the patient of alternate actions before resorting to death with dignity, such as Compassion in Dying, which is a nonprofit organization that supports the right of terminally ill patients to hasten their deaths. One of the main responses to the slippery slope argument is that there isn't enough evidence to prove the claims that physician-assisted suicide leads to involuntary euthanasia. Those who are against physician-assisted suicide mentioned that Dutch physicians who performed approximately 1,000 cases per year, or 0.8% of all deaths nationwide, did so through non-voluntary euthanasia. It was then proved that most of those patients were already near death or had become incompetent after initially asking to be euthanized. It was also proved that the euthanasia was passive and consisted of withholding or withdrawing further care. According to authors Elizabeth M. Norton and Pamela J. Miller, another response to the slippery slope argument is that social workers who were opposed to the physician-assisted suicide due to religious or philosophical-based reasons changed their views to the fact that the slope isn't so slippery, and this is a process in which they trust. The Death with Dignity Act assists patients who are terminally ill with a disease they have no control over, to have control over in the way they die. In the case of Evelyn, a breast cancer patient who watched her condition worsen by awful waves of pain, violent coughing, constipation, abdominal cramps, convulsions, and humiliation, she had trouble breathing and walking, as the sickness was taking over her body. The help of the Death with Dignity Act came into play. According to Lawrence Rudden, Evelyn was transferred to an assisted living facility and was told she had less than 6 months to live. During that time, plastic tubes were strung up, around, and through her body. She laid on her hospital bed like a wax figure, and this was not the way she wanted to spend the rest of her days, and after being informed of other options, Evelyn decided she wanted to die with dignity. She was able to die in the presence of her loved ones and was able to do so without pain and with dignity. Denying the opportunity for physician-assisted suicide, there have been patients who have ended their lives in a more violent way. In the case of Emmanuel McGeorge's cancer, he was denied the choice of physician-assisted suicide, and according to his wife Patsy, did not want to be a sedated vegetable. Emmanuel therefore took matters into his own hands and carefully lodged a shotgun into his mouth and pulled the trigger. The Death with Dignity Act has provided patients with the opportunity to die peacefully and has prevented more than 57 people from committing violent suicides during the past 5 years, states George Imee, the executive director of the Oregon branch of the Compassion in Dying Federation. I believe that not regulating the Death with Dignity Act can lead to harsher consequences, such as a patient taking matters into their own hands and attempting suicide. The problem with this is that their attempt can fail and cause the patient even more distress. With the help of a physician, the patient will be monitored and it'll minimize the chances of a failed attempt. They will die with the assistance of a physician surrounded by their loved ones while dying with dignity.